Which is the most common complication of myocardial infraction? A. Hypokalemia, B. anaphylactic shock, C. Cardiac arrhythmia, D. Cardiac enlargement. Correct answer is C. Cardiac arrhythmia. In the immediate post-operative period following a splenectomy, the nurse especially should observe the client for A. shock and infection, B. intestinal obstruction and bleeding, C. hemorrhage and abdominal distension, D. peritonitis and pulmonary complications. Correct answer is C. hemorrhage and abdominal distension. When a client has haematuria, the nurse should observe for A. diarrhea, B. acetone in urine, C. symptoms of peritonitis, D. gross blood in the urine. Correct answer is D. gross blood in the urine. A client has hypoglycemic reaction to insulin. Assessment indicative of this response includes pallor, perspiration, tremor, B. excessive thirst, dry hot skin, C. anorexia, glycosuria, tachycardia, D. fruity odor to breath, acetonuria. Correct answer is A. pallor, perspiration and tremor. Cerebrospinal fluid is secreted by A. pyometer, B. arachnoid villi, C. choroid plexus, D. corpus callosum. Correct answer is C. choroid plexus. The pacemaker of the heart is A. SA node, B. AB node, C. AB bundles, D. Purkinje fiber. Correct answer is A. SA node. What regulates the muscle contraction in our body? A. sodium calcium, B. potassium calcium, C. sodium potassium, D. sodium potassium calcium. Correct answer is D. sodium potassium calcium. Which blood group of human being is universal receiver? A group, AB group, O group, B group. Correct answer is B. AB group. Prevention of disease by using drugs is known as treatment, vaccination, prophylaxis, chemo blockage. Correct answer is C. prophylaxis. Liver is the largest organ in the body. The liver stores iron in a form of protein called fibrinogen, ferritin, hemoglobin, globulin. Correct answer is B. ferritin. When is the best time to collect urine specimen for routine urinalysis and CS? Early morning, later afternoon, midnight, before food. Correct answer is A. early morning. Which of the following is the meaning of PRN? When advised, immediately, when necessary, now. Correct answer is C. when necessary. Which of the following not administered by intradermal route? BCG, insulin, Montauk's drug sensitivity test. Correct answer is B. insulin. Which of the following is not a two-way communication? Lecture, group discussion, presentation, case study. Correct answer is A. lecture. Nursing intervention of the patient who is at shock stage is elevate the both leg, start IV fluid, check vital signs, send for hospitalization. Correct answer is B. start IV fluid. What is the first step of planning? Set goal, prioritize the need, write a plan, objective setting. Correct answer is B. prioritize the need. Getting things done correctly is the skill of leadership, staffing, organization, management. Correct answer is D. management. Which type of assignment is more famous in workplace? Functional method, team method, patient-centered method, individual method. Correct answer is C. patient-centered method. Nepal Nursing Association is established in 2018, 2017, 2016, 2015. Correct answer is A. 2018. Which of the following institutions don't constitute the sanction post of staff nurse? Primary healthcare, district hospital, health post, zonal hospital. Correct answer is C. health post. IQ level between 50 to 70 would be classified as what kinds of mental retardation? Mild, moderate, severe, borderline. Correct answer is A. mild. Holistic nursing regards and treat the mind, body and spirit of the client, disease, spirit and family, desires and emotion of the client, muscle, bone and nerve disorder. Correct answer is A. mind, body and spirit of the client. Mental disease can be treated by all except counseling, medicine, rehabilitation, evaluation. Correct answer is D. Evaluation. The common cause of low birth weight of the baby is protein deficiency diet of the mother, iron deficiency diet of the mother, calcium deficiency diet of the mother, vitamin deficiency diet of the mother. Correct answer is A. Protein deficiency diet of the mother. Kwashiorkor or disease of children is due to protein deficiency, carbohydrate deficiency, genetic problem, vitamin deficiency. Correct answer is A. Protein deficiency. The stage of growth and development basically concerned with the role identification is the oral stage, genital stage, oedipal stage, latency stage. Correct answer is C. Oedipal stage. Injection of vitamin K is given to the newborn to decrease peristalsis, decrease the risk of infection, decrease the risk of hemorrhage, decrease calcium absorption. Correct answer is C. Decrease the risk of hemorrhage. Rh isoimmunization causing hemolytic disease occurs if mother is Rh positive and child is negative, mother is Rh negative and child is Rh positive, both mother and child are Rh negative, both mother and child are Rh positive. Correct answer is B. Mother is Rh negative and child is Rh positive. How much the non-pregnant uterus weighs? 10 gram, 50 gram, 80 gram, 100 gram. Correct answer is B. 50 gram. Oral contraceptive protect against thrombosis, cervical cancer, ovarian cancer, liver cancer. Correct answer is C. Ovarian cancer. Oral contraceptives are not given with streptomycin, rifampicin, antibiotics in ethambutol. Correct answer is B. Rifampicin. Best progesterone for the emergency contraception is norethistron, medroxyprogesterone, desogestrone, levonorgestrel. Correct answer is D. Levonorgestrel. Vesicovaginal fistula is the false passage created between vagina and rectum, vagina and urethra, vagina and urinary bladder, vaginal and perineal muscle. Correct answer is C. Vagina and urinary bladder. The most common indication of caesarean is first stage of placenta previa, vaginal atony, primary uterine inertia, cephalopelvic disproportion. Correct answer is D. Cephalopelvic disproportion. During delivery, HIV transmission occurs mostly during first trimester, second trimester, third trimester, during labor. Correct answer is D. During labor. Kamala KC's contraction gradually increases in strength and become more frequent and last longer. Her membrane ruptures. The first step for the nurse to take is call the doctor, monitor the fetal heart sound, test for contraction, check pulse and blood pressure. Correct answer is B. Monitor the fetal heart sound. Pregnancy-induced hypertension with seizure is known as preeclampsia, eclampsia, epilepsy, rigor. Correct answer is B. Eclampsia. Where does the fertilization occurs? Ampulla, isthmus, ovary, fallopian tube. Correct answer is A. Ampulla. Vector of Kala-azar is A. flea, B. tsetse fly, C. sandfly, D. mosquito. Correct answer is C. Sandfly. Highest vitamin A content is seen in lemon, green leafy vegetable, tomato, rye. Correct answer is B. Green leafy vegetable. Milk is rich in all except vitamin A, vitamin D, vitamin C, iron. Correct answer is D. Iron. Coptic spots are seen in rubella, rubiola, measles, typhoid fever, chickenpox. Correct answer is B. Measles. Beriberi is a disease caused due to lack of vitamin A, vitamin B, vitamin C, vitamin D. Correct answer is B. Vitamin B. Family size is determined by total fertility rate, general fertility rate, age-specific fertility rate, gross reproduction rate. Correct answer is A. Total fertility rate. Epidemiological type refers to agent host environment, agent host mode of infection, agent host source of infection, agent host reservoir of infection. Correct answer is A. Agent host environment. The primary responsibility to create a safe environment before, during and after surgery is concerned to scrub nurse, circulatory nurse, surgeon, anesthetics. Correct answer is B. Circulatory nurse. Widal test is used for the diagnosis of tuberculosis, typhoid, cholera, malaria. Correct answer is B. Typhoid. Elderly people have high incidence of hip fracture because of carelessness, fragility of bone, rheumatoid arthritis, sedentary existence. Correct answer is B. Fragility of bone. When patient has suffered from head injury, the first investigation is X-ray, CT scan, MRI, ultrasound. Correct answer is B. CT scan. When caring a client with a spinal cord injury, the initial responsibility of nurse is to prevent contraction and atrophy, avoid flexion and hyperextension of spine, prevent urinary tract infection, prepare the client for vocational rehabilitation. Correct answer is B. Avoid flexion and hyperextension of the spine. यस्तै भिडियोको लागि प्लिज मेरो युट्युब च्यानललाई सब्स्क्राइब गर्नुहोला। त्यसैगरी यो भिडियो लाइक र शेयर गर्न नभुल्नुहोला। धन्यवाद।